All right, what is aftercare like? What do you have to do after your procedure to take care of these hairs, and how much of a nuisance is it? Well, step one to hair restoration is just try not to touch the grafts. Let them be. Let them integrate. These things are very delicate. They no longer have a blood supply when they're taken out of the body, and they have to reintegrate through the connections that your body's forming over the first 5 days. And it takes a while for these blood vessels to grow in place and to reintegrate. So you just want to not touch the hair. So you need to be in a situation where you can be a little delicate, where you're not going to be doing physical labor. You're not going to be working, not going to be wearing a hat. You just need to let these grafts sit, especially for 5 days, if not for the full 10. To take care of the grafts, you're essentially going to keep them hydrated for 5 days. We're going to use a little misting bottle, spraying water in the air, letting it fall on your grafts, keeping them hydrated, not keeping them too damp, just keeping them hydrated. And after 5 days, you're going to switch over to an oil base. This oil base is going to keep the grafts lubricated, but at the same time, it's going to loosen up the scalp. You are going to wash the grafts. Starting on day 2, you're going to use soapy water to place over the grafts, to pour on top of them, let the soapy water pour on top, and then rinse it off with regular water. And on day 5, you're going to start mixing in the soap with your fingertips. And on day 10, you're back to normal shampoo and conditioner. But you are going to be washing your hairs starting on day 2 after your procedure. You're going to be taking antibiotics after your procedure. Make sure you don't get infection. You very rarely ever need pain medication. Most people are off by noon the next day. But the main thing you're doing here is just letting the grafts be. Now, the hardest parts after transplantation, the first 5 days, is to sleep, because you can't put any pressure on the grafts. And most times the grafts are up front. Some people get them in the crown. But you can lay down anywhere on your scalp that's not the new grafts. So usually 2 to 3 pillows on your bed. You don't necessarily have to be in a recliner. But people say that sleeping is a little bit difficult because they're worried about knocking and hitting the grafts while they're sleeping. The second 5 days, a lot of people say that there could be itching. And that's because the nerves are regenerating the back of the head. We core out these little tunnels, and those little holes could have contained nerves in them, and those nerves need to regrow. And until nerves actually regrow back to the point of where they do their normal job, they can act erratically. They can burn, they can itch, whatever. And so people say the next 5 days after sleeping difficulties is the itching itself. But around the 10-day mark, everything kind of goes back to normal. We see in the clinic, we wash false scabs, people feel much better. You just have kind of these oddities that may be lasting, like a little zinger to a nerve that's a little sensitive, which is going to go away in a couple. But taking grafts pretty easy. You're going to wash them. You're going to keep them hydrated. You're just going to make sure you don't hurt them. The most difficult times is when you're sleeping, is make sure that you don't knock them.